What if I told you that the very pills you're taking every day, ones that seem completely harmless, might actually be stripping away your manhood, little by little, without you even realizing it? Millions of men over the age of 60 are facing a decline in sexual desire, erectile dysfunction, chronic fatigue, and they often blame it on aging. But the truth is far more unsettling. Sometimes the real culprit isn't time, but the medications you're taking daily for high blood pressure, cholesterol, depression, or sleep problems. According to a report from Harvard Medical School, there are at least 5 common drug groups frequently prescribed to older adults that can lower testosterone, suppress libido, and even cause long-term erectile dysfunction. And unfortunately, most patients are not warned about these side effects in advance. But don't worry. In today's video, Dr. William Harris, will help you identify 5 medications that are silently destroying men's sexual health after 60 and show you safer alternatives that can help protect both your overall well-being and your intimate life. And don't skip the beginning of this video, because I'll be revealing one particular drug that's incredibly common, yet it tops the list for killing testosterone, and it's something many doctors don't even warn their patients about. Before we dive into the main content, let me get to know you a little. Where are you watching from? Leave your answer in the comments section. I'd be truly glad to know who I'm sharing this journey with. If this is your first time visiting the channel, don't forget to hit the subscribe button and turn on the notification bell so you won't miss future videos on natural testosterone recovery after 60. So what are we waiting for? Let's take a look at the first drug, one that's sitting in the medicine cabinet of over 40% of men over 60, and why it may be slowly weakening your masculine strength every single day. Drug 1. Blood pressure medications. When blood flow is blocked, so is your manhood. Did you know that some blood pressure medications, especially diuretics and beta blockers, can quietly reduce sexual function in men over 60? These drugs are commonly prescribed to lower blood pressure and protect the heart. However, the way they work can unintentionally reduce blood flow to the genitals, leading to erectile dysfunction or a noticeable drop in sexual desire. Specifically, thiazide diuretics lower circulating blood volume and may cause electrolyte imbalances, both of which can impair pelvic blood vessel dilation. Meanwhile, beta blockers like atenolol and propranolol slow down heart rate and suppress sympathetic nerve activity, which is critical for arousal and maintaining erections. Many men in their 60s report that they began to feel numb or had difficulty getting or maintaining an erection after starting blood pressure meds, yet they assumed it was simply due to age. Of course, treating high blood pressure is essential, but you should also know that not all antihypertensive drugs cause these side effects. Some alternatives, like ACE inhibitors or angiotensin receptor blockers, ARB, are considered less likely to impact sexual function and may be a safer choice if you're experiencing libido or performance issues. So don't hesitate to speak with your doctor if you've noticed any changes in your sexual health since beginning blood pressure treatment. There may be better suited options available. You just need to know that you have the right to ask and be supported properly. In the next part, we'll take a look at another widely used medication, prescribed for lowering blood fat levels, but one that may quietly drain your testosterone, the key hormone behind male vitality. Dear viewers, if you're still watching at this point, I'm truly glad you care this much about your health. Drop the number 1 below in the comments so I know you're still here with me. Drug 2. Cholesterol-lowering statins. When testosterone is sacrificed for cholesterol. Statins are a very commonly prescribed group of medications used to lower LDL cholesterol, often referred to as bad cholesterol, which is a major risk factor for cardiovascular disease. However, there's a fact that not many people pay attention to. Cholesterol isn't entirely bad. In fact, it's the raw material your body uses to produce testosterone, the key hormone that determines a man's sexual health and overall vitality. When statins are used over a long period of time, especially at high doses, the body's ability to synthesize its own cholesterol can be overly suppressed. This can lead to a silent drop in natural testosterone levels, followed by symptoms such as reduced libido, unexplained fatigue, low energy, and weakened erections. Several studies conducted at Boston University have shown that men who take statins long-term tend to have significantly lower testosterone levels compared to those who don't, even when their heart health markers improve. That said, not everyone experiences these side effects. Some men maintain normal sexual function while on statins, especially if they combine their treatment with a healthy lifestyle, balanced nutrition, and regular physical activity. If you're taking cholesterol-lowering medication and feel that your vitality has declined, don't ignore the signs. Your doctor might be able to adjust your dosage or consider alternative therapies that have a lesser impact on male hormones. And coming up next, I'll talk about a group of medications that seem harmless because they're often prescribed to support mental health. But for men over 60, they could be one of the hidden reasons why desire fades and pleasure becomes harder to reach. Drug 3: antidepressants. When emotions are suppressed, so is desire. Not many people would think that antidepressants, medications prescribed to improve mood and emotional well-being, could be a silent culprit behind the loss of sexual desire in men over 60. In particular, selective serotonin reuptake inhibitors, SSRIs like fluoxetine or sertraline, though effective at stabilizing mood, can directly interfere with dopamine, a neurotransmitter responsible for pleasure and sexual arousal. When serotonin levels rise too much and dopamine levels fall, many men begin to feel emotionally detached, less interested in intimacy, or even unable to achieve sexual satisfaction despite still having regular sexual activity. Some also experience delayed ejaculation or an inability to ejaculate, which significantly affects the quality of their intimate life. What makes this more complex is that these side effects don't usually show up right away. They tend to appear silently after a few weeks or months of treatment, and many patients don't realize there's a connection between their antidepressants and their declining sexual performance. However, if mental health treatment is necessary, you should never stop taking these medications on your own. Instead, have an open conversation with your doctor. There are other antidepressants with fewer sexual side effects or non-drug therapies such as cognitive behavioral therapy, CBT, that can be considered based on your specific condition. Continuing our journey today, I'll be sharing a surprising paradox. There are medications prescribed to improve urinary function and support prostate health, but they may unintentionally weaken the very hormone that gives men their strength. If you're still watching this video, thank you for staying with me this far. I truly appreciate it. Drop the number 3 in the comments below so I know I'm not talking to myself. Drug 4. Prostate enlargement medications improved urination but lowered hormones. For many men over 60, problems like frequent nighttime urination or difficulty urinating due to benign prostatic hyperplasia, BPH, can feel like a never-ending struggle. And in most prescriptions for this condition, active ingredients such as finasteride or dutasteride, belonging to the class of 5-alpha reductase inhibitors, are commonly recommended as a go-to solution. These medications work by blocking the conversion of testosterone into dihydrotestosterone (DHT), a more potent form of hormone linked to prostate growth. By reducing DHT levels, the prostate can shrink, improving urinary flow and lowering the risk of acute urinary retention. However, the downside is this. When this conversion process is suppressed long-term, the overall levels of male hormones in the blood can also drop, leading to reduced sexual desire, lower genital sensitivity, erectile dysfunction, and in some cases, decreased semen volume during ejaculation. Quite a few men have reported that after several months of taking finasteride, they began to feel a kind of disconnection from their sexual emotions, even though their physical activity remained the same. This condition can sometimes reverse after stopping the medication, but in other cases, it may last for several months, a phenomenon some experts refer to as post-finasteride syndrome. So if you're currently taking medication for prostate enlargement and noticing a decline in sexual performance, don't overlook the possible link between the two. Talk with your doctor to reevaluate your treatment plan. It may be possible to improve both urinary health and hormone balance together. And there's still one more group of drugs that often gets overlooked, because they seem to be just about sleep or anxiety relief. But in reality, they may quietly numb the sexual nervous system, causing you to lose sensitivity and control in your most intimate moments. Let's dive into that next. Drug 5. Sedatives and sleeping pills are artificial sleep that steals your real strength. Sedatives, anti-anxiety medications, and sleep aids, such as diazepam, lorazepam, or zolpidem, are frequently prescribed to older adults to help with sleep or manage nervous tension. However, numerous studies have shown that these very drugs can numb the sensitivity and response of the sexual nervous system, seriously affecting male sexual health. The way sedatives work is by suppressing the activity of the central nervous system, calming the brain and reducing anxiety. But along with that relaxation comes a blunting of sexual stimulation signals, which can lead to reduced arousal, dull sensitivity, and erectile dysfunction. Additionally, long-term dependence on sleep medication may make it difficult for the body to enter natural sleep cycles, which is the exact time the endocrine system works to restore itself and produce testosterone. Artificial sleep simply doesn't provide the same hormonal restoration as deep, natural sleep. Another important point: drugs in the benzodiazepine class can also cause diminished reflexes and delayed orgasm, making sex feel passive, dull, and emotionally unsatisfying. So if you're currently taking sleep aids or sedatives, don't forget to monitor how they may be affecting your sexual health. There are non-drug alternatives, such as relaxation techniques, sleep hygiene strategies, or behavioral therapy, that can be safely used in many cases. At this point, you might be asking, if I can't just stop taking these medications, how can I restore testosterone and desire naturally? In the next section, I'll be sharing with you simple, effective, and science-backed solutions that many men over 60 have successfully used to reclaim their vitality without having to sacrifice their overall health. Part 2. Don't stop medication abruptly. Act the right way to protect both your health and your manhood. After identifying 5 groups of medications that may affect testosterone and sexual function, the first thing I want to emphasize is this: don't rush to stop your medications immediately. Drugs like those for blood pressure, cholesterol, depression, or prostate issues often play an important role in maintaining overall health. Stopping them suddenly can cause serious consequences, especially for older adults. Instead of reacting drastically, the best thing you can do is consult your doctor directly. Many physicians can adjust the dosage, switch to medications that have less impact on sexual hormones, or combine them with supportive therapies to minimize side effects. At the same time, there are safe and natural approaches to help boost your body's own testosterone and improve sexual health without interfering with treatment. Some solutions that many men have found effective include adding foods rich in healthy cholesterol like boiled eggs or extra virgin olive oil, because this is the raw material for testosterone production. Light, regular physical activity, especially exercises that improve pelvic blood flow. Quality sleep. Sleeping 7–8 hours per night helps your body naturally restore testosterone. Reducing chronic stress, as prolonged stress increases cortisol, a hormone that works against testosterone. Using supportive herbs such as ginseng, maca, or horny goat weed, with appropriate dosage and guidance. A proper combination of medical treatment and supportive lifestyle changes can bring sustainable results without negatively impacting your overall health. But to truly restore vitality after age 60 in a long-lasting way, you need a clear, manageable strategy that won't overburden your body. And right now, I'm going to share with you 3 science-based recovery steps that many men have successfully applied within just a few weeks. You definitely don't want to miss this. Part 3. 3 steps to restore testosterone and sexual function naturally. A science-based roadmap for men over 60. Restoring performance after age 60 doesn't necessarily require testosterone boosters or aggressive interventions. In fact, many men who experienced erectile dysfunction or low libido due to medication side effects regained confidence simply by resetting their biological rhythm and supporting hormone production through simple daily habits. Here are 3 proven recovery steps that have delivered real results. Step 1. Stimulate pelvic blood flow each morning. Every morning, spend 3–5 minutes doing pelvic floor exercises like gentle Kegels or hip mobility movements. These help stimulate blood flow to the genital area, supporting natural erectile response and tissue regeneration. Step 2. Start your day with hormone-friendly nutrition. Include 1–2 boiled eggs, some avocado or walnuts, in your breakfast to provide healthy cholesterol, the building block of testosterone. Pair that with a cup of warm ginger honey tea or turmeric water to boost metabolism and reduce low-grade inflammation. Step 3. Relax the nervous system and optimize sleep at night. In the evening, prepare your body to activate the parasympathetic nervous system by practicing slow breathing, taking a warm bath, listening to soothing music, or meditating for 5 minutes before bed. This enhances hormone production during nighttime, the golden window for the body's natural recovery. This routine doesn't require fancy equipment. It's simple, adjustable, and works well with any daily schedule of an older adult. The most important factor is consistency, because healthy sexuality doesn't come from luck, it comes from being proactive and understanding your body's needs. Dear friend, There's one factor that's rarely talked about, but plays an extremely important role in recovering sexual health, and that is emotional and mental balance. Many men after 60 experience feelings of disappointment, loss of self-confidence, or label themselves as being past their prime. This leads to long-term psychological suppression, which directly affects sexual reflexes and internal hormone activity. Here's the truth: your brain controls more than you think. When you are stressed, anxious, or emotionally disconnected from yourself or your partner, your body produces excess cortisol, the enemy hormone of testosterone. On the other hand, relaxation, feeling understood, and believing that you're still valuable help the endocrine system function better, naturally reactivating your sexual reflexes without force or pressure. Sometimes, just a small gesture like holding hands, having a genuine conversation, or truly being present with your partner can rekindle an emotional connection that's been fading for years. And that can have a bigger impact than any prescription drug. If you've stayed with me until the end of this journey, please remember this: your manhood is not something you've lost. It's a value that's still within you, waiting to be awakened through understanding, intentional action, and a deep respect for yourself. If you found this video helpful, don't forget to subscribe and turn on the notification bell, because in future videos, I'll continue to share essential knowledge to help men over 60 maintain their health, reclaim their confidence, and live with strength every single day. See you in the next video.